Hello everyone, hope so all of you are fine and welcome to my channel. Today we will discuss about epidural anesthesia. Epidural anesthesia is injected in epidural space of spine. Ligamentum flavum and dura mater in between it is injected. Means epidural anesthesia is injected between ligamentum flavum and dura mater. It lasts longer. This is a disadvantage of epidural anesthesia. Catheter can also pass in space for giving opioids after surgery. Disadvantages of epidural anesthesia include injection phobic people, body sepsis people, intracranial pressure not raised, hypovolemic and antiplatelet therapy not given. Drugs given are neostigmine, it inhibits acetylcholine and effect of muscle relaxant, atracunium and susamethonium. These drugs used to prevent muscle relaxant. Disconnect drugs used for unconsciousness, that is propofol, isothane, atropine, acetylcysteine, neostigmine and acetylcholine. Analgesics plus oxygen should be continued. Reasons when anesthesia effect is long lasting after surgery: airway obstruction, hypoxia and hypercapnia, electrolyte imbalance and hypotension. Post-operative care. To avoid and maintain post-operative anesthesia care is very important. Objectives include assessment, pain relief, prevent complication, monitor proper record maintaining. Phases of recovery include recovery phase, immediate or post-op, care inbound and follow-up. Care in wards, maintenance of health, ambulation to prevent DVT, pain management according to WHO ladder, oral fluids, intravenous fluids. Most common medications are PPIs, antibodies, NSAIDs, heparin and fluid. Nutrition care include 4 to 5 days not then sodium. NG tube is inserted, nasogastric tube. Physiotherapy, chest complications, DVT, pressure ulcers and care after infection. Phase 2 recovery phase. Patient shifts in recovery room. Pulse oximeter is used. BP is monitored. Equipments from which drug is injected. Fluid to maintain plasma level. Patient not die due to surgery, he can die due to complications. Management includes airway, breathing, circulation, BP, pulse check after 15 minutes, anxiety relief, pain. Position of patient change after 2 hours to avoid pressure ulcers. DVT prevention by ankle pumping and anti-triglyceride therapy. Follow-up. Tell patient about infections. Guide about complications. Tell about proper care and nutrition. Give proper medications. Call about proper follow-up sessions. What is trauma? Cellular disintegration or cell death leading to the cause of death of cells is called trauma. Uncontrollable bleeding occurs in trauma. Discover bleeding loss, stop bleeding and tissue perfusion. That was all about our today's lecture.